Interventional radiology plays a crucial role in the treatment of thyroid nodules. We can treat benign thyroid nodules to patient with symptoms to reduce the symptoms of patients, but also we can treat malignant thyroid nodules like micropapillary thyroid cancers or recurrences in the neck occurring after surgery, for example. Interventional radiologists can use several different techniques for the treatment of thyroid nodules. We can use ethanol ablation, for example, for benign cystic nodules, but also thermal ablations like radiofrequency, laser, or even microwaves can be applied in the treatment of both benign solid thyroid nodules or micropapillary cancer or recurrences in the neck from thyroid tumors. So we have a large toolbox of procedures that can be used for the treatment of patients with thyroid nodules. Interventional techniques are indicated for the treatment of benign nodules when they are symptomatic. We are not removing completely the nodule, but only achieving a dimensional reduction. So the aim is to reduce the volume of the nodule to improve symptoms. If patients do not have any kind of symptoms, there's no indication for the treatment. At the present, thermal ablations are indicated for malignant thyroid nodules smaller than 1 centimeter when they do not reach the thyroid capsule. So for the so-called micropapillary thyroid cancer. In some cases, we can also treat recurrences in the neck when they are not suitable for surgical management or in case of patient unwilling to undergo surgery. Patients with benign thyroid nodule can expect to achieve at least 50% volumetric reduction of their nodule, which is correlated with symptoms improvement. And this is achieved in a very large majority of cases, more than 90%. Patients with malignant thyroid tumors may achieve the complete destruction of the tumor when they are properly selected. So they can have a complete treatment without the problems related with surgery. In case of palliation, for patients unsuitable for surgery, patient may achieve a local control, which is the highest level of cure that we can provide to this kind of patients.